Student Side by Flourish Community. We went on a journey of asking a few students the following questions. What is the meaning of the phrase multidisciplinary team, or MDT, to you? What is your definition or idea of mental health and wellness? How does your future profession help in an MDT to promote and manage the mental health and wellness of patients?
Hi, my name is Anila Shulubani. I am a third-year nursing student at Stellenbosch University. To me, a multidisciplinary team is a group of professionals that help a patient achieve their highest health outcomes. Mental wellness is not just the absence of disease, but it is a holistic approach to being healthy in your mind. As a professional nurse, we are responsible for the everyday nursing care activities for a patient. So our role in helping the MDT take care of mental health is to be there for the patient every single day. It is to help them with the different activities that they need help with. For example, during the activities of daily living, it is carrying out our nursing care plans and making sure that the patient's healthcare needs are met every single day. I hope that this video encourages everyone to take care of their own mental health. And for the future healthcare professionals, I hope that this video encourages you to do your bit as part of the multidisciplinary team. If you're not a future healthcare professional, I still hope that it encourages you to advocate for your own mental health and for others as well.
My name is Owetuma Kasana, and I am a final year speech therapy student. So an MDT, or a multidisciplinary team, is where a group of healthcare professionals come together and collaborate and share the same interest for the patients and try to find the best way possible to treat the patient while also taking the holistic person into consideration. So to me, mental health and wellness means looking after your brain space, as I would call it. You try to create a very safe and comfortable environment within yourself, and you take care of yourself. You take care of your thoughts and how you feel. So that is what mental health wellness means to me. So my role as a speech therapist within the MDT is to ensure that the patient is not treated as a medical case only, but we take into consideration the person as a whole. So I provide counseling to the patient about what is going on with their bodies and what our findings are, and provide ways to support them and explain to them what changes are happening to them and specifically why these changes are happening to them, so that they can also feel supported. And it's so important that we as healthcare professionals also meet our patients halfway to tell them that we're not only treating what you have, but we're also considering you as a person. My message to us all is that we should continue to be advocates of mental health and mental health wellness. We should take care of not only our mental health, but those who we treat. We need to treat people with consideration and always ensure that we are not the cause of their mental health struggles, but we rather help them deal with them in a positive way.
Hi, I'm Rhea, and I'm a final year physiotherapy student studying at Stellenbosch University. So what does the MDT mean to me? The MDT is your multidisciplinary team, and it's made up of your doctors, your nurses, your social workers can even be included in this, then your allied health members like your dietitians, speech and language therapists, occupational therapists, and physiotherapists. So for me, the MDT is when all of those components come together to form an approach that best fits our patients so that they can get the best outcome from their treatment and actually achieve what they want to achieve without making it what our goal is, but focusing on their goal and incorporating each element of what they struggle with into their treatment. So mental health and wellness for me, being a child who was diagnosed at a very young age with ADD, now I described as ADHD, but with more of an attention deficit component. Mental health for me was more like, I didn't really understand until coming to university, where I wasn't told I can't have something because I'm smart. But also coming to university and dealing with anxiety and depression, it was difficult because I felt kind of like an imposter. Like, if I have these, why can't I be like, I shouldn't be here. Like, I'm here to look after and treat people who have these elements of mental health that contribute to their treatment. But at the space that I'm in now, it is a small component of what we are, and learning to identify what helps me when I'm in a anxiety attack, or I know my anxiety is heightened, or I can feel like my depressive onset of a depressive episode or mood. I personally will tend to either chat to my friends, or actually, for me, go for a run and clear my head and spend time at the gym. For me, exercise is often one of those things that helps decrease my anxiety and boost my mood substantially. So this is a very passionate cause to me, as I do suffer from mental health, particularly my ADD, but I don't see that as an issue. I use it towards as my superpower, and also anxiety and depression. However, having facilities available to us as students, that we are not put on a 3-month waiting list or something like that if it's considered non-emergent, is very important to me. And also making it more talked about and welcoming, and week, and actually bringing it into lectures, because people are still stigmatized to this day if they show that they have anxiety or depression. So being a physiotherapist, people often describe us as the mobility doctors or the exercise specialists, and all we really do with our patients is make them exercise and sweat. But actually, that's not what we do. We do incorporate movement and getting them back to their highest functional ability into our treatment. However, when it comes to their mental health and wellness, we often ask them what did they enjoy doing, and then tailor our things towards that. However, if it's something that's out of our scope, we tend to often refer, because we don't want to work outside our scope of practice. So in terms of like a patient, for example, who suffered a stroke, we'd tailor her approach and make her more motivated into showing her, like, look where you came from, and this is where we're going, and like the progress is the most important thing. So for me, being in an outpatient setting lately, having family members ask if they can record a session, and then show their family member after how it's gone, and like where they started and now where they're ending. And for me, that is just an amazing part of mental health and wellness that we contribute to a person in our treatment.
My understanding of the I want to sneeze. So my message to other professionals in the MDT, as well as people around, people around.
So for me, if my patients are feeling, trying to restart that.
Mental healthness. Things. Cut.
Thank you so much for watching. We look forward to your likes and your subscriptions, and of course your comments and engagement in this conversation.